My name is Vivian, and over the last 10 years, I've had 3 sinus procedures done to my nose. 2 stenoplasty, I think that's how you say it, and 1 balloon procedure in between those 2. The last one it was in 2013. I trusted my ENT to try to correct some things he said needed fixing from the last doctor. He's the one that also did the balloon procedure, which was actually extremely painful to me, and for some reason I had a bad reaction and passed out during the test. My experiences now have changed my life. I used to sing a lot and had more energy and didn't suffer the facial pain that I feel all the time now. I have extremely dry nose syndrome to the point of waking up numerous times in the middle of the night, which I had first, after surgery, woke up every 15 minutes for the first 26 days. When that finally passed, I now sleep sometimes 2 hours at a time, and then sometimes 15 minutes at a time. It just depends on how dry my nose is. I constantly have to shove things into my nose to give me moisture. My septum area is bone dry, and I have serious nerve damage across the base of my nose here and running up into my trigeminal nerve, which I have been diagnosed now with trigeminal neuralgia. I did have some broken jaws during the surgery. I'm not sure what he was doing in there, but during the surgery he did break my jaws. Both of them are extreme pain and trigeminal shooting that direction as well as through the top of the head. I noticed that my breathing, even though I do not have but about 10 to 15% of my turbinates cut, I'm suffering nerve damage in that area, and that my breathing is very shallow. Even though I can talk and I look normal, my breathing causes me to feel dizzy. Most of the time, I don't feel that I'm getting the right amount of oxygen, even though my oxygen is showing fine on the little thing they put on your finger. I have serious asthma, which this has agitated even further, and I literally live with a nebulizer attached to me most times of the year. I do sometimes experience some moisture coming from the top of my nose, which will just drain on its own without any feeling. I believe that the balloon procedure also had a lot to do with my trigeminal nerve being damaged. This has been very difficult for me. It has changed my life tremendously. I have a hard time attaching to people because I sleep with a humidifier and a CPAP, which sometimes I have to actually take that CPAP off because I'll start choking even with the help of the CPAP. It's very hard for me to use it because I have nasal PAPs that go under the nose because I can't handle the pressure of the one that goes over the face. So my drying is even worse when I'm having to use that. And then here is my breathing treatments that I do consistently. That's my nebulizer and all the medications that I have to take for my asthma, which has exacerbated, I guess that's the word, gotten worse since the empty nose, I guess. Or like I said, I did some studying and found out you don't have to have all of your turbinates cut to have the serious symptoms of empty nose syndrome. Mine are pretty extreme. My facial pain sometimes makes me look like I'm in a very grouchy mood most of the time, and I feel very short with people, have headaches all the time, and constant pain like somebody has hit me in the face. Constantly around the edges of my nose here if I start drying in the septum severely without any moisture that I put in, which is vegetable glycerin. I use a lot in my nose, which has caused me some staph infections over time. But when it does dry out, it's very like pulling on the sides of my face even more. It's a very unexplainable feeling, and this has actually been a life-changing experience for me. I'm learning to adapt to it, but I feel that I'm suffering more than I should. I still put on my makeup, and some days it's hard for me to put it on or to actually take it off of my face once I have put it on, because my nerve damage in my face is very severe, especially within the area of my nose here. On the inside, though, it's very hard for you to see it. But I really hope that they can find something to help with the nerve damage so that it doesn't continue to get worse. And for the people who need their turbinates rebuilt, I'm hoping that that will come about soon, because there is so much suffering, sleeplessness, dry nose, inability to keep up with people, friendships, the desire to live life. I don't have the energy. Most days I just sit on my couch. If I'm able to work, it's amazing, and when I do, I'm wiped out, not like I used to be. I was optimal at my job. I was a full-time massage therapist, and now I am crippled in that as well. Able to maybe do 1 job or 2 jobs a week now, and that's been very debilitating for me. I hope something can be done, and I hope this video helps. Thank you.